Today we're going to focus on a very interesting company, which is called Plantable Health. And I have the privilege and the honor to have the founder and CEO, Nadja Pinnavaia, joining us. And we're going to have the opportunity to do a bit of an in-depth review and discussion about the company, where it stands, how things are evolving, and how we should look at it within the context of the market as we know it today. It's a very active and volatile market, and in fact, an interesting period when you think about it. To the audience, feel free to ask any questions. You can leverage the Q&A function on the Zoom. When you ask a question, I will make sure that it's being asked and put forward to Nadja, and that you get a good answer to it. But Nadja, let's start with first things first. I was looking at an article that came out about the company quite recently, very recently, yesterday, and it said, one of the lines in there was a great definition of your company, the first clinically supported lifestyle program that combines delicious plant-based nutrition and behavioral psychology to reset metabolic health. So that's a mouthful.
It is a mouthful. I was about to say that. Yes.
I think it's a good way to start and give the audience a bit of a good feeling of what is a company, what is it doing, what is it about, and yes. I think there's a lot in there.
Yeah. Thank you, Jos. And by the way, thank you so much for having me on. It's always wonderful to be back. So Plantable is a dietary lifestyle intervention. We are all about making it easy to lose excess weight, to restore our health and well-being by changing our eating habits. We know that we're in a mess in terms of our health is worsening, the health costs are exploding, and Plantable is a turnkey solution to make it really easy to give people the tools to change their eating habits. I started the company about 7 years ago. It came about from yet another crisis of cancer in the family when I started to read about how today's modern lifestyle, and in particular our modern diet, is impacting our health, it's impacting our metabolism, but the real kernel is we just can't get enough of it because it's actually ironically driving hunger. And so it's not enough to say to people, well, you should just eat differently. We kind of know that, but really what we're doing is giving people the tools through personalized coaching, which provides the support and the education platform, understanding each individual, their needs and their habits, and combining it with delicious, nutrient-dense meals that are designed to keep someone full in these first 28 days, because that way then we can help the brain readjust and say no to the cookie or no to the pretzel chips. And so we've created a fully immersive program that makes it really easy to change, with really great results, spectacular results, which then fuels the motivation to carry on living in this lifestyle.
Could you say a little bit more about the clinically supported component, the scientific component? I also read about the fact that you're doing some research that is in progress, because that's a very big and quite unique component. It takes us a little bit in the discussion about what makes you different from other companies that we all see a lot of advertising from companies who are promising you in the world, but you are very different. I think the scientific one is one component, and there's more, I know.
Well, my background is actually one of science from many years ago. So I took a very scientific approach to Plantable. I have a PhD in quantum chemistry. And so what we've done is when I started the company, as I said, driven from lifestyle, we understood about how what we eat impacts our health. So I'd done all this reading and I wanted to put it to the test. So when we started Plantable, we started to collect clinical data, which included blood work, so blood sugar markers, cholesterol markers, inflammation markers, as well as weight loss markers and reduction in waste, all of the things on the outside. And because I wanted to prove, I'd done all this reading, I wanted to actually see, what happened when people lived the Plantable reboot experience for 28 days. And those results were so remarkable. And this, we're talking about 6-7 years ago. It was kind of very early back then, that those results have now formed the basis of clinical trials with some pretty prestigious medical institutions, Memorial Sloan Kettering, Weill Cornell, and Johns Hopkins, to study the reboot program. So the Plantable program, again, that mixture of the coaching and the education and the meals as an effective tool for weight loss, which is a marker for cancer. So we're working on breast cancer, myeloma, and prostate. And then outside of that, the reduction of all of those markers for blood sugar and chronic disease. And so I think it is quite unique because probably with my science background, we're clinically supported and very soon to be clinically proven. We've done this for 7 years. We know how it works. But the medical institutions kind of couldn't believe that people could do this. They've never seen the results that they saw with us. And so we're in prominent clinical trials now to show the efficacy of Plantable as an intervention.
No, it's fascinating, and I think that this is an element that anyone should be looking at and thinking about. That is that scientific component, and then you also use another word which is very important: clinical research. You don't hear that very often in this space. Now, the value proposition and the benefit, I would say, for your, let's call it your consumer, your customer, I think is pretty clear. Now, if you look at the company from a different perspective, think about it from the perspective of the investor. What are the elements that are important there in your eyes to share? And I'm thinking about strength, of course, the value proposition that we covered, but maybe elements of diversification in revenue. I'm thinking about nature of how you bring the business to the market. I think there's a technological component to it. Can you tell us a little bit more about those components that make this, an interesting project for an investor?
Yeah, I mean, we sit in the healthcare category. So I'm going to answer kind of, I used to actually work in finance. I worked at Goldman Sachs for many years and used to work in the equity capital markets. And so how I think about Plantable and the investment opportunity is we sit in healthcare, and healthcare is a huge sector that is an older sector and is ripe for disruption. And we're seeing that. We're in the midst of this disruption. And that disruption is coming from digital health platforms, more advanced systems. We're breaking down the bureaucracy and making it easier and cheaper to get things done. Now, you guys are in Canada, we're based in the US. Healthcare costs are exploding, and the consumer is being asked to bear the cost of that through increasing health insurance premium. So where Plantable fits in is a small yet growing, clinically proven company that actually addresses one of the biggest issues that we have, which is the exploding cost of chronic disease. And big food, we can argue, got us into this mess, right? They sell us the dream, the marketing, healthy, but it's full of sugar and the refined ingredients, and it makes us sick. And then big pharma gives us the pills, pops us the pills to not reverse, to not heal, but just sustain. And so we, from an investment point of view, we are a disruption that's coming to the marketplace in that we can both, it's quite interesting, we have a halo effect. You can combine us with a metformin, which is one of the biggest, diabetes drugs, and we make your metformin look really good because we're actually changing people's lifestyles. And so we can be considered as a natural alternative to actually curing diabetes or working alongside your medication to improve outcomes. And so, So we've got various things. So, you've got the healthcare sector that's ready for disruption. You've got a lifestyle program that's clinically proven and works. We're starting to see that. Like, if you look around in New York City, we've got plant-based medicine that's now being covered by certain hospital institutions. So this lifestyle medicine as an adjunct to traditional means is now starting to become accepted. And from our point of view, that's our big, huge opportunity and that's what prompted me to do the clinical trials, to have that clinical truth, because ultimately I want Plantable to be a prescription for effective weight loss and the reversal of the common chronic diseases.
Yeah, that's a very key point that you make. And how can you tell us a little bit more about how are insurance companies looking at this space? And do you see them stepping in, or stepping up is maybe a better way to say it?
They're really starting. So when we started this company 6 years ago, so we were early, and we started to have insurance conversations. But it was too early. They weren't there yet. But now the marketplace has changed a lot, and especially these last 2 years, it's done a couple of things. One, I think COVID brought a new awakening to the role, the importance of coaching. So you can be effective, the importance of behavior change and giving support through coaching. Number two, the insurance companies now internally with their own employees are exploring not just the clinical efficacy of programs, but the cost efficacy of food as medicine. So, we see that Medicare is now adopting it. We're unique. You mentioned the word unique, is because we are a company that combines two businesses into one. We are personalized behavioral coaching. At our core, we are a behavior modification program. We're treating the addiction to sugar and those things. And in that first instance, we also have food as our medicine, right? Because it's there to keep people full, to make behavior change easier. Because if you're asking someone to change their behavior and you're asking them then to go shop and cook, it's just too much, it's too hard. And that's where these other companies fall down. That's why no one has our results. And so I think the insurance companies are now more accepting of lifestyle solutions and are now looking also at the cost efficacy of these programs, because you have escalating costs that continue to increase. You've got biologic pharmaceutical products now that are becoming more and more expensive, and we need a different solution, and Plantable is that solution.
Yeah. No, I think there's lots of key words that you have said here: healthcare, the exploding costs. We all know it's unmanageable on the longer term. A different solution that, in fact, is not only producing real results, but is also going to help to reduce that cost. And I would say, the proof is in the pudding when you see insurance companies looking at it, because they will not look at it because they like your product. They will look at it because they see that as a means to reduce their risk fundamentally, and cost and coverages that they have for patients in a space where number of patients is exploding. Like I saw some statistics about the obesity in the US, and it still blows me away when I see it.
Yeah. And there's also, you've got the insurers, and so let's call them the payers, right? So you've got the health insurers, the payers, also the self-insured corporates. So on the whole, about 95% of all companies with more than 5,000 employees bear the ultimate financial risk. They'll use an administrator to run the plan, but they're the ones, writing the bulk of the checks. So those costs are continuing to explode. You've also now got the health system, so the hospitals that are now being paid and covered on a kind of value basis. So if someone's had a stroke or an operation, and that person has to be readmitted, they're not getting paid again by the insurance company. It's kind of a one shot. And so there's also an opportunity, which we've seen that we've started to reach out, and I'll tell you about some of the hirings we've made, of working with health systems that say, look, someone comes in, they've had a heart attack, they had a stroke. We say, hey, you're alive, go home now, and good luck, keep your fingers crossed. And our program is so powerful. And it's not just me saying that, but our clinical results that we've seen are so powerful that we have a phenomenal opportunity to work with these hospital systems, because we will keep people back out of the hospital, out of the ER. Because in 28 days, in as little as 28 days, you can see significant reversal of atherosclerosis, of the markers associated with heart disease risk. So it's huge, it's very powerful.
How would you define, and forgive me, I keep asking you questions here about what you're doing and where you are today, and we start to talk a bit about the evolution of the ecosystem around you. But what is your market? How would you define your market, and how would you size it? Just to give people a little bit of a perspective of, what's the market you're going after?
It's a great question. So our market, we can be many things to many people. However, what we are known for, what we do really well, is effective weight loss, effective health-driven weight loss. So, people shed weight. Let me just give you some kind of numbers. So within 28 days, they normally lose about 9 pounds. That's about 4 kilos. And then within 3 to 6 months, they're losing 10% of their excess body weight, which 5% is already medically, statistically important towards health. 10% is a massive improvement. So the weight loss market in the US alone is, broadly speaking, it's a $70 billion market. It is dominated, and again here, ready for disruption, from two, 3 legacy companies, the Jenny Craigs, the Nutrisystems, the Weight Watchers. The Weight Watchers is slightly different. They're more of more of that coaching program, right? But the Nutrisystems and Jenny Craig, between the two of them, have $1.1 billion in revenues. You asked earlier about our how we're different in our science. Many of these weight loss programs have been built upon what's now understood to be outdated science on calorie restriction, portion restriction. But when you understand what sugar and highly processed ingredients are doing to our body, we need to cut back on those. And so, we have the right science, which is based upon a nutrient-dense diet that's full of fiber, that is reducing all of those highly inflammatory ingredients. So it is a industry, even just dominated by those two players, that is huge and ripe for new entrants to come in. And actually, if you look at successful new entrants, you see what Noom has done over these last couple of years. Now, Noom is a digital platform, digital coaching platform. It doesn't give that personalization, the one-on-one, the onboarding with a telephone call that we do. And it doesn't combine the meals. And so it's a lot harder for people to get the effective results that we see on Plantable. But it's a huge industry.
I was going to say, it's a pretty sizable market, and you're just starting to touch it. Nadja, what are your longer term plans, like product wise, service wise, geographically? Like, how are you looking at tomorrow? So a bit in the crystal ball.
Yes. So actually, just last week, we announced the arrival, the hiring. We brought on board Jim Wachtel, who joins us as our Chief Growth Officer, and he's going to be responsible for all of our institutional relationships. So as we've discussed, there's a massive, significant opportunity with the institutions, the insurers. So that is our big focus going forward. And that will coincide with the conclusion of our clinical trials that start to come through at the end of this year. I mean, we know we've been doing this for a long time, but those clinical trials will start to come through. So that is our big strategic focus in really being that natural prescription that will be subsidized by insurance, and an effective tool for the self-insured corporates and the hospital systems, as we discussed. In terms of product development, our tech team is working really hard. We should be launching our kind of V2 of our digital health kind of ecosystem. The great thing about Plantable is when people come to us or come into our ecosystem, you know, when we bring them the meals and the education and the coaching, because it's so profound, they then carry on living in that lifestyle. So the digital platform will bring everything together, our website, our app, and unify it, improve the accessibility to our recipes, maintaining that lifestyle. And then, so that should be coming by the end of this year, and will also position us for our institutional clients. And then thirdly, in terms of product change, again, we're all about getting people into this lifestyle and making it really easy to keep them in this lifestyle. So we're developing a line of, I call it the CPG line, but think kind of sauces, condiments, spice packs, you know, all the things that for you, the consumer, it takes you a while to shop and chop and cook and think, oh my God, how am I going to make this? And how am I going to make sure I've got enough protein to keep me full? And is it balanced? So we're doing all of the heavy thinking for you and giving you those building blocks in a way to facilitate you in this lifestyle, which ultimately, you know, bears fruit for us, because the more people stay in the Plantable lifestyle, the more they come back to us and they, you know, they buy our products and they stay a long-term customer.
I was going to say recurring revenue and leveraging technology as a core component of your go-to-market. Again, key points for everyone to well understand. So, if we take it to the next component, let's talk a bit about the market now. Let's talk a bit about the financials, about how the company is doing from that perspective, how the stock is doing, and you know what your message is today to shareholders and potential new investors. I think you already gave a lot of messages to potential new investors in defining what you do and what differentiates you. But what is your message to your shareholders? Maybe start a bit with that.
My message to our shareholders today and future ones is our opportunity is so massive, and we have, over the course of these last 3 to 4 months, built out an amazing, we're a very small and tight but amazing management team, with now the marketing capabilities and the sales, and the technology, product development and operations. So those kind of key roles have now been filled, and the opportunities we've described ahead of us is massive. So now it's one of kind of laying those foundations and building and building kind of our product and getting ourselves known. So that's really what Q1 and Q2 have been about, building the B2C foundations and then laying the foundations for the institutional growth. With regards to the stock price, being a new public company CEO, that we IPO'd on January the 12th, and seeing the stock price react to no bearing to company news was initially really, really hard. It's become easier now, but it was very significant. That being said, as I mentioned, I grew up in the financial markets. I grew up on the trading floor, and so I'm aware of both economic and market cycles. We have there's no liquidity in the market. That's dried up, especially at that smaller cap, micro cap level, which is where we're at. And there's been an increase in volatility. However, it is these moments when you have the greatest opportunities. When I was at Goldman Sachs Asset Management, I actually ran the fund of hedge fund business, and we used to invest in hedge fund managers. And there was a most brilliant equity long short manager who every now and again, periodically would send out investor emails. We were invested with him, and he said, now is just, there are such dislocations in the marketplace that we are loading up on this position, it makes no sense. And so my message to future investors and investors out there is, now is the time to look to these companies that are working hard, that if you believe in the management team, and if you believe in the opportunity, then at these prices, it's the time. It's a massive opportunity. These opportunities come for a moment of time, and then they're gone. And so that's what I would say. Do the work, do the due diligence, understand the company's fundamentals, make an assessment on the opportunity and the management team. And if you think it's worthwhile, now is a great time to be looking at certain opportunities, certain companies. And I put Plantable in that category. And by the way, full disclosure, I was buying. I was allowed, we've reported it, I'm a buyer at these levels. So.
Yep. No, I think, Nadja, you make a couple of key points over here. Like, it is clear that the market for the moment is under severe stress. We know some of the drivers are obvious. Inflation, interest rates going up, the crisis in Ukraine, supply chain. So there's a tremendous amount of pressure on the market, and it has impacted it. And who gets impacted first? It's growth companies. It's companies that just when interest rates change, calculations of net present value change, and markets go down, people pull back, people sit on the fence. Retail steps out of the market. There's much less retail activity in the markets today. And what do I see on the other side? I start to see institutionals coming in. You made your point, that was the other point that is also very key when you talked about that long-short hedge fund manager. They are now looking at the market and they're going like, wow, there are opportunities over here. And when you take a look at the market, I didn't look at how it did today yet, but you also see that the volatility is high. It becomes higher and higher and higher. And that means that we are in a kind of period where selling and buying is, if I can put it this way, fighting each other. There's still people who want to step out, but you have people who start to see those opportunities and who start to step in. And without giving any advice, it's not up to us to give advice to investors or potential investors. But the message that I would definitely leave with them is, this is a period of opportunities, and do your homework. Look at companies. I think there's a company here, Plantable Health, that you should definitely have a look at. I think today we had a good feeling about the vision, the offering, what I would define as the in-depth thought through approach, how it positions itself versus some of the competitors in the space, the size of the market, movements in the ecosystem around this organization, all factors to look at. And then the team, yourself, Nadja, your background, which is a multifaceted background, but also including a component which is capital markets or financial markets. So I think all those are interesting elements to look at, and I would really recommend people in the audience and people who will listen to this in the future to take an in-depth look at this organization, and then come to your own conclusion. But definitely an organization to look at. Nadja, it's quite fascinating how time always goes by, and it's a pleasure also to talk with you. I got to say, you're part of the most interesting people that I'm always having conversations with, and I'm already looking forward to our next session. But I would like to thank you. I would like to thank you for the candor, for the insights, and for the information that you shared. I think it was very valuable, and I wish you a lot of success. I think you're on something indeed big and very interesting. And the last question I will ask you, some of people in the audience or who will look at this on social media will say, can I get access to Nadja's products, to Plantable Health products, if I'm in Canada?
Well,
not yet.
Not yet. Soon, I hope. So with our digital health platform, that will allow us to roll out internationally. And the next markets we're going to focus on are Canada and the UK. So I'd say stay tuned. But no, unfortunately, we can't send our meals yet into Canada, though we are actually looking at that. So stay tuned, maybe is the word to say. But when they come to the US, let us know, and we actually have award-winning concert pianist, a Korean lady who actually was the first lady we turned around her type 2 diabetes. She goes back to Korea for performances, and she takes 5 weeks worth of plantable meals when she travels to Korea. So come to the US, load up your bags, and take your meals home.
Well, so there is a solution to get access to it, but also thank you for ending on that note. So I'm sure that the audience and the consumers here in Canada will stay tuned and are looking forward to your further growth. And here we're talking about geographical growth. Nadja, thank you very much. This was very, very insightful. And as I said, wishing you wonderful months and years to come, because I'm sure you will deliver on the promise.
Thank you. Just thank you so much for having me. It's always a pleasure to be with you and the team at the NEO. Thank you for all that you do.